Hello, and welcome to our brand new study guide for your big nursing exam. I am so excited to help you learn, so we can pass this test together. You might feel a little nervous right now, but please do not worry at all. We will take things slowly, and make sure you understand every single important detail clearly. Getting ready for this nursing test takes time, but I am here to help you. You are going to do great, and I know you will become a wonderful practitioner. Let us start this learning journey, and make sure you feel totally prepared and confident. Section 1 is all about understanding the cancer continuum, which covers screening and early detection. We will learn how to identify patients who have a higher risk of getting sick. You need to know the rules for screening tests, like when to order a mammogram. It helps to catch problems early, making treatments much easier and more successful for patients. I want you to pay close attention to hereditary risks and basic genetic counseling steps. We must also look at basic diagnostic tests and how to read those medical results. Learning these steps gives you a solid foundation before moving to complex treatments later on. Before we jump into our practice questions, let me explain some very important medical concepts. You must understand how staging works, because it decides the best treatment plan for patients. A staging guideline tells us how far the disease has spread inside the human body. We use different performance scales to see if the patient is strong enough for therapy. You also need to understand tumor markers and how they predict a patient health outcome. Always remember that care plans change, depending on the patient history and specific laboratory results. Keep these ideas in your mind, because they will help you answer the questions correctly. Another thing we cover here is patient navigation, helping families deal with difficult medical news. You will act as a guide, showing them exactly what steps to take next safely. We also talk about survivorship plans, making sure patients stay healthy after their treatments finish. I hope you find this lesson helpful, as we explore these early stages of care. Please make sure to subscribe to the channel, so you never miss our new videos. You can check the complete course and the offline app link in the video description. 1. What is the recommended starting age for breast cancer screening in an average risk woman? You should start screening women with mammograms at age 40, based on current medical guidelines. Early detection saves lives, finding small tumors quickly, before they grow into bigger health problems. 2. How often should a healthy adult get a colonoscopy to screen for colon cancer properly? A healthy adult needs a screening colonoscopy every 10 years, starting at age 45. Screen, find the polyps, we need to remove them, and repeat for patient safety. 3. Which genetic mutation puts a patient at the highest risk for developing ovarian cancer early? The BRCA1 and BRCA2 genetic mutations cause a massive risk for ovarian cancer. Genes matter a lot. Test the family. We need to monitor, catch the disease early. 4. Why do we check a patient using the Eastern Cooperative Oncology Group Performance Status Scale? This scale helps me understand if the patient is strong enough to handle harsh chemotherapy. Evaluate their daily strength, check mobility, we must decide, plan the safest medical treatment possible. 5. What does the TNM staging system evaluate when diagnosing a new cancer in a patient? It measures the tumor size, lymph node involvement, and whether the disease has spread far. Staging directs our choices: find the tumor, check the nodes, Plan the best therapy quickly. 6. Which specific tumor marker helps us monitor a patient being treated for advanced prostate cancer? We use the prostate-specific antigen blood test to see if the treatment is working. Draw the blood, check the levels, we need to adjust, ensure the cancer is shrinking. 7. What is the primary goal of creating a survivorship care plan for a recovering patient? It gives the patient a clear map for future checkups and healthy lifestyle habit changes. Guide the survivor, prevent new cancers, we must educate, keep them healthy for many years. 8. How does a low socioeconomic status affect a patient going through the cancer care continuum? These patients often face huge problems getting regular screenings, leading to much later disease diagnosis. Money changes access, find the barriers, we need to help, connect them with community resources. 9. When assessing a patient with a strong family history of cancer, what should you recommend? I always refer these patients to a certified genetic counselor for detailed testing and advice. Family history is key, test the genes, we must protect, prevent future illness right away. 10. What screening test is highly recommended for an older patient with a heavy smoking history? You must order a low-dose computed tomography scan of their chest every single year. Look at the lungs, spot the spots, we need to act, stop the lung cancer. 11. How do you define a prognostic biomarker when creating a treatment plan for a patient? A prognostic biomarker helps us guess the likely outcome of the disease, regardless of treatment. Biomarkers predict the future, check the results, we must plan, tell the patient what happens. 12. Why is patient navigation so helpful for families dealing with a brand new cancer diagnosis? It removes confusing barriers, helping the patient schedule appointments and understand complex medical system rules. Guide the lost patient, clear the path, we need to support, make their journey smoother. 13. What happens if a cervical cancer screening shows high-grade abnormal cells on the cervix? We need to perform a colposcopy and take a tissue biopsy to check for cancer. See the abnormal cells, take a sample, we must test, find the truth very fast. 14. How should an advanced oncology nurse practitioner talk about reproductive planning with a young patient? I discuss fertility preservation options before starting any treatments that might harm their reproductive organs. Protect their future dreams, freeze the eggs, we must care, offer them hope and choices. 15. What physical sign might indicate an abnormal finding during a routine clinical breast examination procedure? A hard, painless lump that does not move around easily is a very suspicious sign. Feel the breast tissue, find the lump, we need to scan, get a biopsy done. 16. How does age act as a major risk factor for developing most types of cancer? As people get older, their cells collect more genetic damage, increasing the chance of tumors. Cells grow old, mistakes happen often, we must screen, watch older adults much more closely. 17. What is the main purpose of palliative care during the early stages of cancer treatment? It focuses on improving the quality of life by managing pain and reducing severe stress. Stop the severe pain, calm the mind, we must comfort, help them live much better. 18. Which diagnostic test is the absolute best way to confirm a solid tumor cancer diagnosis? A tissue biopsy is the only test that can definitively prove that cancer is present. Cut a small piece, look under microscopes, we must confirm, never guess the final diagnosis. 19. How do cultural differences change the way a patient understands their personal cancer screening results? Some cultures might view a cancer diagnosis as a punishment, making them avoid necessary treatments. Respect their unique beliefs, build total trust, we must educate, guide them to proper care. Welcome back to our learning journey, moving right into section 2 of our study guide. In this specific section, we focus heavily on the scientific basics of cancer disease processes. I know science can seem scary, but we will break down everything together very simply. You will learn how normal healthy cells suddenly change into dangerous and fast-growing tumors. Section 2 also covers the immune system, and how it fights against those bad cells. We need to understand immunology completely, helping me choose the best possible treatments for patients. You will also learn about cell cycles, checking how cancer drugs stop tumors from multiplying. Taking time to study these facts properly makes you a much safer and smarter nurse. Before we begin the next questions, please make sure you have your notes ready nearby. If you need a quick break, you can always pause me and return later on. Remember to subscribe to my channel, and check the description for our complete offline app. Let us jump into the new practice questions, and keep building your wonderful medical knowledge. 20. What is apoptosis, and why is it so important for maintaining a healthy human body? Apoptosis is the normal programmed death of a cell, helping remove old or damaged tissue. Find bad cells, trigger the death, we need to clear, keep the body safe always. 21. How do cancer cells manage to survive when they are supposed to die naturally instead? Cancer cells ignore regular death signals, allowing them to divide and grow completely out of control. Ignore the rules, grow very fast, we must target, stop the tumor from getting bigger. 22. What exactly does angiogenesis mean when we talk about a growing tumor inside a patient? Angiogenesis means the tumor creates brand new blood vessels to feed itself fresh oxygen directly. Build new pipes, steal the blood, we need to block, starve the tumor right away. 23. Which part of the normal cell cycle is the actual resting phase for a human cell? The G0 phase is the resting period, where cells stop dividing and just stay quiet. Stop the work, rest for now, we must watch, wait for the next growth signal. 24. Why do many chemotherapy drugs target cells specifically during the S phase of the cell cycle? The S phase involves copying DNA, making it a perfect time to break the cancer cells. Copy the genes, break the chain, we need to strike, destroy the bad DNA quickly. 25. How does the human immune system normally recognize a dangerous cancer cell inside the body? The immune system spots strange proteins on the cancer cell surface, marking it for complete destruction. See the threat, mark the target, we must attack, kill the abnormal cells very fast. 26. What is the main job of T cells when fighting against a cancerous tumor directly? T cells are special white blood cells that hunt down and kill those dangerous tumor cells. Hunt the enemy, shoot to kill, we need to fight, protect the healthy surrounding tissue. 27. How do cancer cells hide from the T cells trying to destroy them so aggressively? They wear special protein masks that trick the immune system into thinking they are perfectly normal. Wear a disguise, fool the guards, we must unmask, let the immune system see them. 28. What does an oncogene do to make a normal healthy cell turn into a cancer cell? An oncogene acts like a stuck gas pedal, forcing the cell to divide without ever stopping. Push the gas, go too fast, we need to brake, slow down the rapid growth. 29. Why is the p53 gene called the guardian of the human genome in medical science? It stops damaged cells from dividing, fixing the broken DNA or causing the cell to die. Check the damage, fix the code, we must repair, protect the entire human body system. 30. What happens to a patient if their tumor suppressor genes completely stop working right away? Without those helpful brakes, damaged cells will multiply wildly and eventually form a dangerous cancer tumor. Lose the brakes, crash the car, we need to fix, stop the tumor from spreading. 31. How does radiation therapy actually damage the cancer cells hiding deep inside a sick patient? Radiation uses high-energy beams to break the cancer cell DNA, stopping them from dividing anymore. Zap the tumor, break the genes, we must destroy, make the cancer cells die off. 32. What is metastasis, and why does it make cancer so much harder to treat successfully? Metastasis means the cancer has traveled through the blood to a completely different body part. Leave the home, travel far away, we need to track, fight the cancer everywhere now. 33. Which specific route do breast cancer cells usually take when they first start to spread? Breast cancer cells often travel through the lymphatic system, hiding inside the nearby armpit lymph nodes. Travel the tubes, hide in nodes, we must check, clear the cancer out right away. 34. How do targeted therapies work differently than traditional chemotherapy drugs for treating a sick patient? Targeted therapies only attack specific parts of cancer cells, leaving the healthy normal cells mostly alone. Lock the target, spare the good, we need precision, heal the patient with fewer side effects. 35. Why is understanding the cancer cell cycle so important for an advanced oncology nurse practitioner? Knowing the cycle helps me understand exactly when different medications will work best for your treatment. Learn the timing, plan the dose, we must coordinate, hit the cancer at weak moments. 36. What is a genetic mutation, and how does it affect the normal instructions inside a cell? A mutation is a simple spelling mistake in the cell DNA, causing it to behave badly. Spell things wrong, mess it up, we need to find, correct the errors if possible. 37. How does chronic inflammation inside the body increase the risk of developing a new cancer tumor? Long-term swelling damages healthy DNA over time, which can eventually create sneaky cancer cells quickly. Swell for long, damage the code, we must calm, stop the irritation to prevent disease. 38. What role do natural killer cells play in the human body fighting off early cancers? Natural killer cells roam the body looking for stressed cells, destroying them before tumors can grow. Patrol the blood, find the stressed, we need to strike, keep the patient totally safe. Welcome back to our class, moving right into section 3 of our study guide. Today we focus on different cancer treatments, helping you understand exactly how they work. We will look at surgery, radiation, and powerful drugs used to fight the disease. I want you to feel confident, so we will learn this very slowly together. Surgery removes the visible tumor, acting as the first step in many treatment plans. Then we use chemotherapy, which travels through the blood to kill hidden cancer cells. You need to know how these drugs work, and how they affect the patient. Understanding these side effects helps me, and it helps you keep our patients safe. Before we start the questions, grab a drink of water and take a breath. Please remember to subscribe to our channel, so you never miss a new video. You can also find the complete offline course app link in the description below. Let us answer these new questions, building your confidence for the big nursing exam. 39. What is the main purpose of surgical oncology when treating a new solid tumor? Surgery aims to completely remove the main tumor, stopping the cancer from spreading further. Cut it out, clear the edges, we must act, remove the bad tissue fast. 40. How does adjuvant chemotherapy help a patient after they have a successful tumor surgery? It destroys any tiny remaining cancer cells, making sure the disease does not return. Clean the blood, kill the rest, we need to protect, keep the patient cured. 41. What is neoadjuvant therapy, and why do we give it before a planned surgery? We give this treatment first to shrink a large tumor, making surgery much easier. Shrink the mass, make it small, we must plan, help the surgeon do better. 42. How do alkylating agents work inside the body to destroy dangerous cancer cells quickly? These strong drugs damage the cell DNA directly, preventing the cancer from dividing anymore. Break the code, stop the growth, we need to strike, kill the dividing cells. 43. Why do patients lose their hair when taking traditional chemotherapy drugs for their cancer? Chemotherapy attacks all fast-growing cells, which unfortunately includes the healthy hair follicle cells. Target fast growth, hit the hair, we must explain, support the patient through changes. 44. What is external beam radiation therapy, and how does it treat a localized tumor? A large machine sends strong energy beams directly into the exact tumor location daily. Aim the beam, zap the spot, we need to focus, destroy the local cancer. 45. How does brachytherapy differ from standard external radiation treatments given to a sick patient? We place tiny radioactive seeds inside the body, right next to the actual tumor. Plant the seeds, burn from inside, we must be exact, spare the healthy organs. 46. Why must a nurse wear protective gear when handling dangerous chemotherapy drugs every day? These powerful medicines are highly toxic, and they can harm your own healthy body. Wear the gloves, wear the gown, we need to shield, keep the nurse safe. 47. What is the goal of giving a patient targeted biologic therapy for their cancer? It blocks the exact signals that tell specific cancer cells to grow and divide. Find the signal, cut the wire, we must block, stop the tumor from communicating. 48. How do monoclonal antibodies help the human immune system fight against a dangerous cancer? They attach to cancer cells, acting like flags so the immune system can attack. Tag the cell, wave the flag, we need to guide, let the fighters win. 49. What is an infusion reaction, and when does it happen to a receiving patient? It is an allergic response happening while the patient receives their intravenous cancer drugs. Watch the breathing, check the skin, we must react, stop the drug immediately now. 50. Why do we check blood counts before giving a patient their scheduled chemotherapy dose? We must ensure their white blood cells are high enough to safely fight infections. Draw the blood, count the cells, we need to check, prevent a deadly infection. 51. What does the term nadir mean when discussing a patient receiving aggressive chemotherapy treatments? Nadir is the lowest point of blood counts, usually occurring 1 week after treatment. Hit the bottom, watch for fever, we must protect, keep them safe from germs. 52. How can a nurse help a patient managing severe nausea caused by their chemotherapy? I always provide strong antiemetic medications before the treatment starts to prevent any sickness. Give the pills, calm the stomach, we need to care, make them feel comfortable. 53. What is a central venous catheter, and why do cancer patients usually need one? It is a special tube placed near the heart, making drug delivery much safer. Place the line, save the veins, we must use it, stop the skin burns. 54. How does hormone therapy help treat patients diagnosed with early-stage breast or prostate cancer? It blocks the natural hormones in the body that feed and grow these tumors. Starve the tumor, block the food, we need to lower, keep the hormones away. 55. What is immunotherapy, and why is it so exciting for modern cancer care professionals? It boosts the patient immune system, teaching their own body to fight the cancer. Train the body, boost the guards, we must support, let nature do the healing. 56. Why is a stem cell transplant sometimes used after very high doses of chemotherapy? The heavy drugs destroy the bone marrow, so we give new cells to rebuild. Clear the marrow, plant the seeds, we need to grow, make new healthy blood. 57. How do we safely dispose of medical supplies that touch dangerous chemotherapy chemical drugs? We place all used items into special yellow bins meant only for toxic waste. Use the bin, seal the trash, we must separate, keep the whole hospital safe. Welcome back, everyone, to section 4 of our amazing learning journey together. Today, we are focusing heavily on managing side effects, keeping our patients comfortable always. I know treating cancer is very hard, but we can make things much better. We will learn how to handle pain, nausea, and feeling very tired easily. When patients receive strong medications, their bodies often react in very uncomfortable ways. It is my job, and your job, to fix these problems right away. We use different medicines to stop the nausea, before it even starts happening. Controlling pain is super important, because nobody should ever suffer while getting better. Before we start our new questions, please take a moment to relax yourself. Remember to hit that subscribe button, so we can keep learning together daily. You can also find the complete offline app link down in the description. Let us look at these new questions and practice keeping our patients smiling. 58. What is the best way to assess cancer pain when a patient first arrives? You must always ask the patient to rate their pain on a number scale. Ask the patient, trust their words, we need to know, treat the pain quickly. 59. How do we manage a patient complaining of severe, constant bone pain daily? We use long-acting opioid medications around the clock to keep them completely comfortable. Give the pills, block the pain, we must act, keep them resting very peacefully. 60. What is breakthrough pain, and how do we treat it in our clinics? It is sudden severe pain, treated using short-acting pain medications right away. Pain flares up, act very fast, we need to treat, give fast relief now. 61. Why do cancer patients often experience terrible constipation during their long treatment plans? Strong pain medications slow down the bowels, making it very hard to use bathrooms. Bowels slow down, stomach hurts bad, we must help, give them a gentle laxative. 62. What is cancer-related fatigue, and how does it affect a sick patient? It is an extreme tiredness that does not improve with normal sleep or rest. Feel very weak, cannot stay awake, we need to care, help them save energy. 63. How can a nurse help a patient dealing with severe cancer-related fatigue? I teach them to save their energy for very important tasks during the day. Plan the day, take short naps, we must guide, keep them moving very safely. 64. Why is proper mouth care so necessary for patients receiving harsh chemotherapy treatments? Chemotherapy can cause very painful mouth sores, making it super difficult to eat properly. Brush the teeth, rinse the mouth, we need to clean, stop the painful sores. 65. What should a patient use to clean their mouth if they have sores? They should use a soft toothbrush and rinse with basic salt water every day. Keep it soft, avoid harsh alcohol, we must wash, heal the broken mouth skin. 66. How does peripheral neuropathy feel for a patient receiving powerful chemotherapy nerve drugs? The patient will feel tingling, numbness, and burning pain in their hands and feet. Nerves get damaged, fingers feel numb, we need to check, keep them from falling. 67. What safety advice must you give a patient suffering from severe peripheral neuropathy? You must tell them to wear strong shoes, preventing cuts on the numb feet. Protect the toes, clear the floors, we must warn, prevent bad accidental patient falls. 68. Why do some cancer patients lose their appetite completely during their hospital stay? The treatments often change how food tastes, making everything taste like nasty metal sometimes. Food tastes bad, stomach feels full, we need to try, offer small tasty meals. 69. How can we encourage a very sick patient to eat more healthy food? We should offer small, frequent meals packed with extra protein throughout the entire day. Serve small plates, add extra calories, we must feed, keep their body very strong. 70. What is cachexia, and why is it dangerous for advanced cancer care patients? It is severe weight loss and muscle wasting that makes the patient very weak. Lose the fat, lose the muscle, we need to watch, support their failing strength. 71. Why must we monitor a patient carefully for signs of depression and anxiety? Dealing with a cancer diagnosis causes massive emotional stress, requiring professional mental health support. Notice the tears, hear their fears, we must listen, offer them a safe space. 72. What is alopecia, and how does it emotionally affect a newly diagnosed patient? Alopecia is sudden hair loss, causing patients to feel very sad about their appearance. Hair falls out, confidence goes down, we need to hug, offer wigs and hats. 73. How do we treat severe nausea that happens right before the chemotherapy starts? We use calming medicines and special relaxation techniques to soothe their nervous stomach early. Calm the mind, stop the fear, we must act, prevent the sickness from starting. 74. What is lymphedema, and when does it normally happen to a cancer patient? It is painful arm or leg swelling, happening after doctors remove important lymph nodes. Fluid builds up, arm gets heavy, we need to wrap, massage the swelling away. 75. How can a patient with lymphedema protect their swollen arm during daily activities? They must wear a special compression sleeve, and avoid carrying heavy bags or boxes. Wear the sleeve, avoid heavy lifting, we must protect, stop the fluid from pooling. 76. Why is proper sleep hygiene so important for patients recovering from cancer treatments? Good sleep helps the body heal damaged cells faster, giving them much more energy. Darken the room, sleep very deep, we need to rest, let the body recover. Welcome back to our class, ready to start section 5 of our amazing study guide. In this specific section, we are going to learn about very serious oncologic medical emergencies. You will learn how to spot sudden problems, keeping our vulnerable patients completely safe always. I know emergencies sound scary, but we will practice handling them together very calmly now. Sometimes a tumor grows too large, pressing down hard on the delicate human spinal cord. We must recognize those warning signs, preventing the patient from losing their ability to walk. You will also learn about bad infections, happening when white blood cell counts drop low. Knowing these exact steps helps me, and it helps you become a much stronger nurse. Before jumping into the questions, please grab a fresh notebook to write down these facts. Remember to hit that subscribe button, helping our nursing community grow bigger and much stronger. You can find the offline course app, linked quietly inside the video description down below. Let us begin these new questions, making sure you feel ready for your big test. 77. What is the very first sign of dangerous spinal cord compression in a cancer patient? The patient will usually complain of severe new back pain that gets worse lying down. Hear the pain, check the back, we must act, save their legs from permanent paralysis. 78. How do we quickly treat a patient suffering from confirmed malignant spinal cord compression? We must give them high-dose steroids immediately, to reduce the dangerous swelling very fast. Give the drugs, shrink the swelling, we need to call, get the surgeon ready soon. 79. What is superior vena cava syndrome, and why is it considered a medical emergency? A tumor blocks the large chest vein, stopping normal blood flow back into the heart. Vein gets blocked, face turns red, we must breathe, clear the path for the blood. 80. What physical symptom clearly shows a patient might have superior vena cava syndrome right away? You will see intense swelling in their face, neck, and upper arms during your assessment. Face gets puffy, veins pop out, we need to scan, start radiation therapy very quickly. 81. Why do patients with tumor lysis syndrome develop very dangerous heart rhythm problems so suddenly? Dying cancer cells release huge amounts of potassium, which easily disrupts normal heart muscle beating. Cells break open, potassium spills out, we must flush, protect the fragile heart from stopping. 82. How do we prevent tumor lysis syndrome before giving a patient very aggressive chemotherapy treatments? We give them plenty of intravenous fluids, and a medicine called allopurinol to protect kidneys. Give the fluids, clear the waste, we need to wash, keep the kidneys working perfectly. 83. What is neutropenic fever, and why does it scare oncology nurses so much in clinics? It is a high fever happening when the patient has almost no white blood cells. No defense left, body gets hot, we must panic, start the antibiotics within 1 hour. 84. What is the most important nursing action when a neutropenic patient suddenly develops a fever? You must draw blood cultures immediately, and then give strong antibiotics without any long delays. Find the bug, give the drugs, we need to rush, stop the infection from spreading. 85. How does hypercalcemia of malignancy actually happen inside a very sick cancer patient? Tumors destroy the human bone structure, leaking too much calcium directly into the bloodstream. Bones break down, calcium goes up, we must act, protect the brain from dangerous confusion. 86. What are the early warning signs of dangerous hypercalcemia in an advanced cancer patient? The patient will feel incredibly thirsty, very constipated, and confused about where they currently are. Drink more water, stomach hurts bad, we need to flush, wash the calcium away fast. 87. How do we usually treat a patient suffering from severe hypercalcemia inside the hospital setting? We provide massive amounts of normal saline fluids, and give bone-protecting drugs called bisphosphonates. Hydrate the body, strengthen the bones, we must correct, bring those high numbers down safely. 88. What is a dangerous pericardial effusion, and how does it harm a cancer patient? Extra fluid builds up around the heart, squeezing it tightly so it cannot pump properly. Heart gets squeezed, blood stops moving, we need to drain, let the heart beat freely. 89. Which symptom tells a nurse that a pericardial effusion is becoming a deadly cardiac tamponade? The patient will have suddenly falling blood pressure, and very muffled heart sounds upon listening. Pressure drops low, sounds get quiet, we must rush, get a needle in there now. 90. What causes the medical emergency called syndrome of inappropriate antidiuretic hormone in cancer patients? Certain tumors make fake hormones, forcing the human kidneys to hold too much pure water. Hold the water, dilute the blood, we need to watch, keep the sodium levels balanced. 91. Why is a low blood sodium level so incredibly dangerous for a hospitalized cancer patient? Very low sodium causes the human brain to swell, leading to terrible seizures or death. Brain gets huge, patient starts shaking, we must fix, replace the sodium very slowly now. 92. How do we safely treat a cancer patient suffering from mild antidiuretic hormone problems? We simply restrict their daily fluid intake, stopping them from drinking too much extra water. Stop the drinks, limit the cups, we need to wait, let the body pee naturally. 93. What is anaphylaxis, and when does it usually happen in the oncology treatment room? It is a deadly allergic reaction, happening right after a nurse starts the chemotherapy medicine. Throat closes up, skin gets red, we must inject, use the epinephrine pen very quickly. 94. How does a malignant pleural effusion make breathing so incredibly difficult for a sick patient? Cancer causes heavy fluid to fill the chest cavity, crushing the soft pink lung tissue. Chest gets full, air cannot enter, we need to drain, help the patient breathe easily. 95. What simple procedure removes that dangerous fluid from the chest of a struggling cancer patient? A doctor performs a thoracentesis, pushing a needle through the ribs to drain the liquid. Poke the chest, drain the water, we must relieve, let their lungs expand fully again. Welcome back for Section 6, the final part of our amazing nursing study guide. In this section, we will talk about professional practice rules and nursing ethics. You have done an incredibly wonderful job learning all this difficult information so far. I am very proud of you, and we will finish this strong together right now. Section 6 focuses on your exact role as an advanced oncology nurse practitioner. We must understand how to protect patient privacy, keeping their medical records totally safe. You will also learn about end-of-life care, supporting families through deep sadness. Knowing these important legal rules helps me, and it helps you keep your license safe. Before starting these final questions, take a deep breath and relax your tired mind. Please hit that subscribe button, helping me create more helpful study videos for you. You can find our complete offline course app link inside the video description below. Let us finish these last questions, making sure you pass your big medical exam easily. 96. What is the main purpose of getting informed consent before starting a new chemotherapy treatment? The patient must clearly understand the risks before agreeing to take dangerous cancer medications. Explain the dangers, answer their questions, we must listen, protect their legal medical rights. 97. How does an advanced oncology nurse practitioner legally protect patient privacy in the hospital clinic? We strictly follow the federal rules, never sharing medical records without clear patient permission. Lock the files, guard the passwords, we need to care, keep their secrets safe. 98. What does the medical term beneficence mean when taking care of a very sick patient? Beneficence means we always take actions that do the most good for the sick patient. Do good things, provide gentle care, we must help, make their life much better. 99. Why is the nursing concept of non-maleficence so important during heavy cancer chemotherapy treatments? It simply means we must always try our best to never cause the patient harm. Check the doses, avoid bad mistakes, we need to watch, keep them totally safe. 100. How can a nurse show respect for patient autonomy when planning their daily cancer care? You must let the patient make their own choices about receiving or refusing medical treatments. Offer the choices, respect their voice, we must accept, let them control their body. 101. What is an advance directive, and why should every cancer patient have one completely filled? It is a legal paper telling doctors what care they want if they cannot speak. Write the wishes, sign the paper, we need to read, honor their final choices. 102. Who makes the medical decisions if a sick patient becomes confused without an advance directive? The legally appointed healthcare proxy will make all important choices for the confused sick patient. Call the family, find the proxy, we must ask, let them decide the care. 103. What is the main difference between basic palliative care and special end-of-life hospice care? Hospice care starts when the patient stops trying to cure their advanced cancer disease completely. Stop the chemo, start the comfort, we need to transition, make their passing peaceful. 104. How do you safely handle a situation where a patient refuses a life-saving treatment? You must respect their final choice, while explaining the risks of skipping the recommended treatment. Hear their answer, explain the danger, we must document, accept what they want fully. 105. Why should oncology nurses always join professional medical organizations to help their daily career growth? Joining these special groups helps nurses learn brand new information and meet other smart professionals. Read new books, attend big meetings. We need to learn, grow our nursing knowledge. 106. What is the purpose of continuing education units for an advanced oncology registered nurse practitioner? These required classes make sure nurses stay updated on the newest cancer treatments and laws. Take the class, pass the test, we must study, keep our medical license active.